Thank you for your interest in the Rural Health Clinic program. You've accessed part 1 of the 4-part session entitled Rural Health Clinic Billing. The Rural Health Clinic Billing session is designed for individuals who may not be familiar with the Rural Health Clinic program and its unique billing requirements. For additional information about the Rural Health Clinic program, please access parts 2 through 4 of Rural Health Clinic Billing, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health. Rural Health Clinic certification is a designation from the Centers for Medicare and Medicaid Services to clinics providing primary care services in certain rural underserved areas. The Rural Health Clinic program provides an alternative cost-based reimbursement system for treating Medicare and Medicaid beneficiaries. This cost-based reimbursement system requires a unique billing approach in order to obtain reimbursement under the Rural Health Clinic program. The cost-based reimbursement system for rural health clinics is determined on an average cost per visit basis. A visit or encounter is defined as a medically necessary face-to-face encounter between a physician, a nurse practitioner, physician assistant, certified nurse midwife, clinical psychologist, or clinical social worker, and a patient. Rural health clinics are paid a flat or all-inclusive rate for each face-to-face encounter with a Medicare beneficiary. The payment rate is based on the anticipated average cost for direct as well as support services, including allocated costs, through the reconciliation of a cost report which occurs at the end of the fiscal year of the provider. In general, if there is no visit, meaning no face-to-face encounter between a Medicare beneficiary and one of the rural health clinic allowable practitioners, there is no payment for an encounter service. So in order for a rural health clinic to receive payment from Medicare for a rural health clinic service, a medically necessary face-to-face encounter must occur between a Medicare beneficiary and a rural health clinic practitioner. As with every general rule, however, there are exceptions. And under the Rural Health Clinic program, the primary exceptions to that face-to-face encounter requirement occur in the provision of flu as well as pneumococcal vaccinations. For rural health clinics, when patients receive a flu and pneumococcal vaccine, those services are reimbursed in addition to the face-to-face encounter paid under the all-inclusive rate. It's important to understand that the rural health clinic billing is unique within the Medicare program. So rural health clinic services are billed to Medicare using a very unique format, and this format facilitates the payment of an all-inclusive rate for each medically necessary rural health clinic encounter. This is unlike traditional Medicare billing for physician services. Rural health clinic services are billed to the Medicare program on the CMS 1450 or the UB04 claim format instead of the usual CMS 1500 claim form used for billing physician services. In Wisconsin, the Medicaid program uses the standard CMS 1500 form for the billing of rural health clinic encounters. This is different than the Medicare program. In general, rural health clinics do not charge any differently for the services they provide. For the services rendered, the charge is the same as a rural health clinic service as it would be for any other similar service billed to any other payer. However, the actual format of the Medicare claim form is substantially different for rural health clinics than it would be for most other payers for similar services. The most common billing difference is for Medicare rural health clinics is the use of the CG modifier to identify a billable rural health clinic encounter that's eligible for reimbursement of the all-inclusive payment rate. The CG modifier on the UB04 claim form is used to identify a billable rural health clinic encounter. When billing Medicare, rural health clinics should report the CG modifier on one line with a medical and/or a mental health procedure code to represent the primary reason for the medically necessary face-to-face encounter. If only an office visit is performed, as shown in the example below, the claim will appear to be fairly similar to most other billing for Medicare services. So in our example, a typical established patient office visit with CPT code 99213 was performed in a rural health clinic for a Medicare beneficiary. In this example, the usual charge for a 99213 was $100. The Medicare claim form, or the UB04 form, would indicate a revenue code of 521, identifying the clinic place of service, the established patient office visit code, a level 3 visit of 99213, and the CG modifier that indicates to Medicare that this is the line item on the claim form that represents the billable encounter and the primary service that was rendered during the course of that encounter. Medicare would process this claim as a rural health clinic encounter, and the rural health clinic would receive its all-inclusive payment rate. However, if multiple services are provided during the course of the encounter, the Medicare claim form can appear quite unusual in comparison to most other billing. So our second example is a Medicare patient that is treated in the rural health clinic, again for an established patient office visit with CPT code 99213. The billable encounter of 99213 is identified with the CG modifier, telling Medicare that this is the line on the claim form which represents the billable encounter. However, during this service, an allergy injection is administered to that patient. The allergy injection, with procedure code 95115 and a charge of $15, is also identified on the claim form. The unique or unusual approach to rural health clinic billing for Medicare purposes requires that the incidental service, such as the allergy injection in this instance, must be combined with the billable encounter charge and represented on the CG line for payment. So in this example, the 99213 charge of $100 is combined with the incidental charge for the allergy injection of $15 to show that the billable encounter charges are a combination of two services representing a total charge of $115. In addition to the incidental service charge being added to the CG line and represented in a bundled charge of $115, additional detail is provided for the incidental service on the same claim form. A second line is included in our example for the allergy injection, the 95115 procedure code, with its unique charge of $15. The total charge on the claim form of $130 appears to be overstated. However, this is correct according to Medicare instructions, since the incidental charge needs to be combined on the CG line with the encounter charge of $100. Additionally, a separate line communicates to Medicare the additional incidental service for the allergy injection, along with the separate charge of $15 for this incidental service. Clearly, this approach for Medicare billing is unique to rural health clinics and can be cause for confusion for those new to the rural health clinic program. Rural health clinic services are reimbursed by Medicare under the all-inclusive payment rate, regardless of the type of practitioner, whether the service is rendered by a physician or a non-physician practitioner, such as a nurse practitioner or a physician's assistant, and without regard to the complexity of the services performed, whether a level of service is relatively low, such as a 99212, or relatively high, such as a 99215. Reimbursement is also without regard to the type of service, whether the service is an evaluation and management service or a minor surgical procedure performed in a rural health clinic setting. All of these services would be reimbursed by Medicare using the same all-inclusive payment rate. Wisconsin Medicaid, however, is different from Medicare in that Wisconsin Medicaid will reimburse a rural health clinic on a fee-for-service basis when claims are submitted. And the difference between rural health clinic reimbursement and fee-for-service payments is reconciled with the filing of an annual cost settlement. As illustrated on this graph, the all-inclusive payment rate for Medicare can vary substantially from traditional Medicare fee-for-service payments. For example, the current Medicare approved amount for typical established patient office visits, a 99213, for example, and a 99214, are $70.93 for a 99213 and $104.86 for a level 4 established patient office visit. However, independent rural health clinics can expect to receive Medicare reimbursement of $83.45 for either of these two services. And provider-based rural health clinics could expect to receive an all-inclusive payment in excess of $192, again, for the same types of services. The cost-based reimbursement system for rural health clinics requires a different approach to Medicare billing, and it yields a different result in Medicare and Medicaid reimbursement. Thank you again for your interest in the Rural Health Clinic program. You've participated in part 1 of the 4-part session entitled Rural Health Clinic Billing. For additional information about rural health clinic billing, please access parts 2 through 4 of the Rural Health Clinic Billing session, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health. Done.